We're looking live right there at Oxford, England, the University of Oxford, where the AstraZeneca vaccine was developed. And that's the backdrop for a fitting gathering today. Health ministers from the G7 attending 2 days of meetings. Canada's health minister attending virtually, we should tell you this morning. But this is all on the issue of COVID-19, on vaccination, on vaccine equity. And Tessa Arcilia is in London following that for us. Good morning, Tessa.
Good morning, Heather. Indeed, quite a symbolic location to be holding that meeting, the site of where AstraZeneca was developed, and indeed vaccine equity is at the top of the agenda. These are ministers of the 7 wealthiest economies in the world. They're going to be talking about the world's poorest countries in the world who don't have access to vaccines at the moment. And the ministers are feeling the pressure. They know they're under time pressure to come up with something concrete and to get things done. Take a listen to the British Health Minister, Matt Hancock.
We need to work together to expand access to vaccines globally. The biggest contribution that we can make is making sure that, especially in the low and middle income countries, that these vaccines are available at cost. That's what we've done with the Oxford AstraZeneca vaccine, and that's what we need to see more of. Other vaccine companies have made moves in that direction, like Pfizer, which I welcome. But ultimately, we're only going to get out of this global pandemic when the whole world is able to get out.
And as you said, Heather, this is going to be 2 days of meetings, a lot on the table. The other thing they want to discuss is coming up with a so-called international approach, basically an early warning system that will be effective in communicating, new variants or new threats to health emergencies, potential health emergencies. Right now, there are scientists keeping track of this, but it seems like the system to get the whole world involved and acting immediately is still flawed. Another thing, Heather, is the suggestion of temporarily waiving patents for vaccines. This is an idea that the U.S. President Joe Biden had backed, and this is just another solution on the table to make vaccine distribution a little more equitable than it is right now, Heather.
Which has been a big push, and there are some new findings, new numbers illustrating the disparity in vaccine equity between developed and developing nations. What are they learning at this meeting, Tessa?
Absolutely. That's what NGOs and charities are focusing on. We talk about disparity all the time, but until we see the numbers, I think that's when we're realizing how big that gap really is. So the People's Vaccine Alliance came up with new numbers. They crunched the numbers, basically saying that the people from the world's poorest nations, it would take them 57 years, Heather, to be as protected as people who live in the G7 countries. Now, that is a massive disparity. They're talking about the rate of vaccination, 4.6 million a day for people living in the G7 countries and just 63,000 in the world's poorest nations. So this is the kind of disparity that NGOs, charities are looking at, and they're sounding the alarm, asking ministers and telling them that this really is time to do something right now. Like the clock is ticking. There is no time to wait. Heather?
Thank you so much. Tessa Arcilia from London.